Hola chicos, este es un ejercicio de shadowing en inglés y se habla de Cancer Blood Test. El ejercicio empieza ahora. Cancer Blood Test. Scientists have taken a step towards one of the biggest goals in medicine, a universal blood test for cancer. A team at Johns Hopkins University has trialed a method that detects 8 common forms of the disease. Their vision is an annual test designed to catch cancer early and save lives. UK experts said it was extremely exciting. However, one said more work was needed to assess the test effectiveness at detecting early-stage cancers. Tumors release tiny traces of their mutated DNA and proteins they make into the bloodstream. The Cancer-Seq test looks for mutation in 16 genes that regularly arise in cancer and 8 proteins that are often released. It was trialed on 1,005 patients with cancer in the ovary, liver, stomach, pancreas, esophagus, colon, lung, or breast that had not yet spread to other tissues. Overall, the test found 70% of the cancers. Dr. Christian Tomasetti from Johns Hopkins University School of Medicine told the BBC, "This field of early detection is critical. I think this can have an enormous impact on cancer mortality. The earlier cancer is found, the greater the chance of being able to treat it." 5 of the 8 cancers investigated have no screening programs for early detection. In some cases, the test also provided information about the tissue of origin of the cancer, but not all. Pancreatic cancer has so few symptoms and is detected so late that 4 in 5 patients die in the year they are diagnosed. Finding tumors when they could still be surgically removed would be a night-and-day difference for survival, said Dr. Tomasetti. Cancer-Seq is now being trialed in people who have not been diagnosed with cancer, which will be the real test of its usefulness. The hope is that complement other screening tools such as mammographs for the breast cancer and colonoscopies for colorectal cancer. Dr. Tomasetti said, "We envision a blood test we could use once a year." The Cancer-Seq test is novel because it hunts for both the mutated DNA and the proteins. Increasing the number of mutation and proteins being analyzed would allow it to test for a wider range of cancer. "I am enormously excited. This is the Holy Grail, a blood test to diagnose cancer without all of the other procedures like scans or colonoscopy." The doctor said that they are very close to using blood tests to screen for cancer as they have the technology. He also cautioned that there was still uncertainty about what to do when a cancer was diagnosed. In some cases, the treatment may be worse than living with a cancer that is not immediately life-threatening. Men can already have slow-growing prostate cancers closely monitored rather than treated. When we detect cancer in a different way, we can't take for granted that everyone will need treated, said the doctor. Detecting cancer early, before the disease has spread, is one of the most powerful ways to improve cancer survival, and this interesting research is a step towards being able to do this earlier than is currently possible.